And hi, my name is Marilyn Miller, and I am the owner of Pilates on Hudson, and I'm here with my client, Anne Malloy, who is going to be being my demonstrator, and I'm going to be showing a little bit about neurokinetic therapy and how it can benefit you and how it works, because it's a new technique we're using, and it's really, really quite amazing. So Anne has been suffering with a couple of things. One of the things that many of you guys have probably is chronic low back pain, and she also suffers from really bad headaches often. So I know a lot of people, especially if you work in a big corporate job or whatever, this is a big concern. And she has sought a lot of treatment for both of these things, and we've been working for a while. But today we're going to see if we can't put those two things together. With a little investigation, we found out that when she was young, she had a traumatic injury to her head and to her forehead, and that's where all of her headaches are. So I'm going to just do a little testing here on her today, and I'm going to show you how this works. So follow along. Right, let's
I have
see.
to do some of this myself.
Yes, you're going to do some of this yourself.
Right.
So she's going to pick her knees up to what we call tabletop position here, right? So knees are at 90-90. There we go. And from here, right, I'm just going to test her abs just by, I put my hand right on her feet. Her legs stay there. And take a breath in for me. Exhale, draw your belly to your spine. And we're going to see what happens to her knees when she draws her belly to her spine. And she either sits up or her legs come down because she's really trying so hard to do this, right? So take a breath in and exhale, belly to spine, right? And same thing, she can't stay, right? Move the knees away from your chest just a bit. Now you're going to take your right hand and put it on that spot on your forehead, right? And all I'm doing is exactly the same thing. She's pressing into the spot where her scar is from her childhood injury. And exhale and press. And I'm pushing as hard as I possibly can, and she goes nowhere. She's going to take her hand away, take a breath in. Exhale, same thing, belly to spine. I'm doing absolutely nothing different here. Exhale. And she can't hold it at all. One more time, put the finger on your forehead, take a breath in. And exhale, belly to spine. And I'm pushing as hard as I can. So that's a quick little thing about how neurokinetic therapy can work, is we find these little spots on your body that there may be a neurological dysfunctional pattern going on, and we release it. So now what we're going to do is a little bit release on her forehead, which is where all of her headaches are, and hopefully her abs are going to turn back on, and we'll get rid of her headaches and get her core strength going. All right, thanks. All right,
So do you want me to take it this way? Or this
No, that way. Yeah. So we were just talking about, and I was kind of showing you, so I'm going to give a little better perspective here of the exercise that we're trying to do. So lift the knees up. All right, good. Belly to spine, take a breath in. So I've been doing some release, but this is the exercise that we're trying to do. And so right now, she's completely solid, right? And put the legs back down. So all we were doing, we were finding that from this childhood injury, she was having a lot of tension. She has a scar on her forehead, and she has a lot of tension right here where her brow comes together, right at the top of her nose. So we're just doing a little bit of release in that, which was very painful for her when we were doing it. But she said this is where she's been getting her painful headaches, her migraines, for many, many, many years, decades, in fact. So now that we're able to do a little bit of release there, we come back over here, lift those feet up, and what we find is now she's able to hold her abs. She's working her deepest abdominal muscles. She has no more back pain when she's doing this. She feels just completely solid, right?
It's relatively effortless.
Yes, effortless. So that's a little demonstration of how NKT can work, especially on some very, very old and very chronic issues that may have. Thanks for watching.